Hi, in this video I wanted to talk with you about a quick analogy of how fast is your vision system going to change in our program. This is a question that gets asked a lot, and I've come up with what I think is a good analogy to talk to you about. But before we discuss that, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. Go to our website, visionforlifeworks.com. You can do several things there. You can take a quiz, you can read some of our success stories, you can read through other information, or you can just schedule a consultation. Now, let's talk about this little analogy I came up with that many patients have been finding to be helpful. They usually say, all right, phase one, you told me it's going to be using those special glasses. What do you call those again? Light therapy glasses, syntonics, neurological light stimulating filters. Yeah, those are the ones. All right, so how long is it really going to take me to notice there's a change with my vision? And what should I expect to see? Well, like I said, this is a question that gets asked a lot. And what I've been telling people lately, because it seems to make sense to them, is in phase one, it's like the electrical stimulation of the brain and the visual system. And what we're doing is we're trying to create momentum so that when we go into phase two, where we're going to be doing some more hands-on approach, more like the kind of mental muscle, if you will, not really lifting weights, okay, or not really even working on specifically trying to improve the muscle, but it is more the physical aspect of the program. So if the first phase is the electrical, the second phase is the physical. And since we're trying to build some momentum going up into phase two to get our biggest impact, it's almost like riding a roller coaster. And if you and I are on that roller coaster together, which I'm really not that big of a fan of roller coasters. I just never happened. But if we're on a roller coaster together and we're trying to get some momentum, we're riding that ride together and we're going up, up, up the hill till we get to the point where we have some momentum to go down. And basically what's happening is phase one is like that part where we're kind of going up, up, up. If you've ever ridden one of those older roller coasters, it's like wooden and you can hear the creaks and the sounds as you're kind of going up. You want to think about your visual system, and your brain is really just starting to kind of creak its way open just a little bit, so to speak. And then as we get to the top, well, hopefully we're starting to get some momentum so that in phase two, down and ready for the next fun thrill. All right, so what happens in phase two is that's where we're going to anticipate seeing the largest amount of progress for you. And so and that's because we've gotten a lot of momentum built up, and so we should start to see some changes more rapidly occurring. Now, that's not to say that many of our patients won't notice changes in phase one, because they will, and certain visual conditions will actually notice more changes in phase one than others. And also, patients who are visually aware will notice more changes in phase one than other patients who maybe aren't visually aware. So it just kind of depends on quite a few factors. But again, most of the changes that we'll see for our patients are going to be occurring in phase two. When does that happen in phase two? Again, it's a little bit dependent on the individual and their visual diagnosis as far as what kinds of things that we start to see. I would say probably about 60% of our patients to 70% still notice some very significant changes in phase one. And even, in some cases that might be even higher. But if we've got a large group of patients who say are not as visually aware, these would be the ones that if your spouse happens to reroute your living room, you may not notice it at first. If your spouse gets a haircut, you may not notice it at first. If there's something different in your home or in your surroundings or at your business, you may not notice it at first. You might just trudge right past it. Those are visually unaware people. Kids, if there's something, maybe like the dog's laying in the middle of the floor and the kid trips over the dog, visually unaware people. They may not notice as many changes in phase one. So I guess the percentage of how our patients notice changes in phase one happens to do with how many of our patients are visually aware versus not visually aware. If we have a higher percentage of aware kids and adults, our numbers are higher. If we happen to have a lower end, our numbers are going to be lower in phase 1, where people are aware of, wow, this really changed already. So we obviously love it whenever our patients notice some success and some changes in phase 1. But again, the biggest bulk of those changes will occur in phase 2, when we are adding a lot of momentum and getting some traction as far as making some changes, not only for like amblyopia or vision loss or binocular vision disorders or strabismus, you insert, or nystagmus, you insert whatever it is there that you want to insert. Now, if you haven't done so already, please make sure you hit the like button, subscribe to our channel, and as I always say, if you find this video to be helpful for someone, maybe you know that they're in therapy, you could pass it on to them. In addition, if you're local to us, give us a call at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com. And your action steps are: call us if you're local versus schedule a consultation if you're not. Thank you.